Welcome back to the Crooked Smile podcast brought to you by Macromedia.
Hello, everybody. Welcome back.
Today we have on urologist Dr. Andrew Tan, but before we get into it, we have a few admin things we'd like to talk about.
Administrative things.
So firstly, 73.6% of you guys who are watching this are not subscribed.
What?
Don't make Gianni upset.
Oh, I'm so upset. Why does this tend to happen on every YouTube account? They're like, 80% are not subscribed.
Well, if that means one thing, it means subscribe. So
Yeah.
make sure you're subscribed if you're watching this. We'd really
God,
appreciate
I feel like
it.
I hate the fact that
We're becoming stereotypical YouTubers
doing
now.
This. Oh, God, that makes me sick.
On that note, leave a comment down below on this episode if you
Stop.
like it or not. If you want better, if you want other questions asked, if you have any feedback, we're open to it.
We're open,
And lastly,
but not too critical because I will cry.
follow the Instagram, because the Instagram is where we're interactive with everyone. We do polls, we do Person of the Week polls.
So much.
We have questions.
Vlogs,
We do Q&A.
talk about life, existentialist debates, cat memes.
Crocodile
there.
on land versus lion in
Crocodile.
water.
Shorts.
So make
really
sure you're
funny
following
shorts.
the Instagram, subscribed, and leaving comments, because that's what we want.
Yeah. But we should talk about our guest. We're very
Yes,
excited.
today's episode's awesome.
So this is basically, I'd liken it to your classic PE sex ed class, but it's run by an expert and it's dispelling the myths of all that sort of stuff. So you'll find out what a urologist is. You can probably work it out. But really interesting chat. You know, we talk about things like breaking the seal, and we get scientific, explanations. Breaking the seal. What else do we talk about?
Not wearing too many pairs of pants.
Not wearing too many
while you
pairs of
sleep around
pants.
your gonads, but
Really important stuff about, rates of testicular cancer in young people, and, talking, breaking down the stigma around that sort of stuff. And, whilst as young people, we think we're invincible, just being ready to, if, some sort of health emergency comes up, not hiding it, having open conversations. So that was really interesting.
and most importantly, a urologist is more than a pair of balls.
I think so. So, yeah.
A lot
Dr.
more.
Andrew Tan from Tackle Talk.
Let's get into it.
Let's get into it.
So Andrew, thanks for being here.
Thanks for having me on.
Finally, after a few incidents, maybe one big incident.
Yeah, there was a few reschedulings required.
Do you want to talk about it, or?
Yeah, sure. Yeah, like I think it was the day before I was meant to come and do this. I fell off my bike, and it was quite a bad injury. I sort of fractured my collarbone and got knocked out and broke a few ribs and
Jesus,
had to be carted off to hospital in an ambulance. So
been painful.
yeah, it has been pretty painful. I mean, I don't know if you've broken ribs before, but it's pretty horrible. That's the worst thing. But I had to have an operation on my collarbone, and they've put a plate in there. So,
A permanent one?
well, I think they can be removed if they become uncomfortable.
Yeah.
So we'll just have to see how it goes. Yeah.
Yeah, right.
And cycling's brutal, right? Because you're traveling at what? 60,
Yeah.
70 Ks an hour?
Was it your fault? Was it your fault, or was it the car's fault?
No, I didn't get hit by a car, thankfully. I might have been dead if that had happened. But
Where'd you get that idea from?
Normally cyclist accidents are cars, aren't they?
No, you just slip.
oh, they can be, but they're usually very
you
very
just fell
severe.
off.
But no, we were sort of in a pace line, so we sort of take turns. There's a bunch of us, and you're one behind the other to draft in the slipstream, and
Yeah.
you take turns sort of rolling off the back and coming up, rolling off the front, coming through the back. And it was just a moment in attention from myself. The pace kind of changed slightly, slowed down slightly. It was still going at about 40 kilometers an hour, but it was on the flat. And I just clipped the wheel in front of me, and it was just, it started dragging me to one side, and I tried to correct it. But what often happens is that it sort of corrects to a point, and then the inertia goes to the other way. So I sort of flipped.
Was that like a moment in time where everything like froze while you were midair?
Well, I didn't really remember that. I just remember hitting the back wheel, and I thought, I'm going to crash and this is going to be painful.
And then you blacked out.
Then I blacked out, and
That was scary.
Yikes.
I never blacked out before. It felt like I was waking up during the week, and I kind of remember having my eyes closed and I was waking up during the week. That's what I thought anyway. And I thought, I've got to go to work. And then I opened my eyes, and it was bright blue sky, and I thought,
How long were you out for?
What am I doing here? Apparently 30 seconds, 20 to 30 seconds, according to the guys I was riding with.
Right, well, we're very glad that you're here now and you're healthy.
Yeah,
and
yeah.
you're
So
Another mark in favour of helmets as well. Like
the helmet got smashed up, but I had a full body scan, so luckily there's nothing else going on.
It's job.
Perfect.
The bones will just take a few weeks to heal.
Well, thanks for your time. Thanks for rescheduling as well. It's we're excited to have you on.
Yeah, so for the audience that doesn't know, Andrew is a urologist.
Yeah.
The director of the #1 largest urology clinic in Perth.
Yeah.
Bit of a flex.
Yeah, well, we're a true group practice, so it's and there's I don't think there is another group practice, so everyone's sort of individuals, so it doesn't take that much to be the #1. But we're probably one of the largest ones in Australia as well, because we keep adding people on. It's not that easy to grow because urologists don't grow on trees. You can't just sort of find them on Seek, But most of the ones that everybody who's come through are people that we all trained with or came through the ranks, and
it's a pretty tight-knit community.
Yeah, there's probably about 30 to 40 in WA. In Western Australia, and throughout Australia there's probably, I don't know, about 300, 400 or so. Yeah.
So what actually is a urologist? Because my brother Robbie the other day called it a penis doctor.
Yeah.
But I know
that's what my kids always called it.
Common misconception.
When they got asked what your dad does at school.
It's actually a lot more than just the penis and the balls.
Yeah. Yeah, it sounds a bit dodgy when you put it that way.
Bring your dad to work to school days.
Yeah. Well, you got to be careful what you talk about. Look, I guess the easiest way of describing us is that we're like the male version. We're like a gynecologist for males.
Yeah.
But we're sort of more than that as well, because we treat everything that the urinary tract involves, so everything that the urine passes through. So it's made in the kidneys, it travels down tubes called the ureters into the bladder, and then you pee it out. And obviously, men and women have bladders, so and men and women have kidneys. So anything to do with kidneys is men and women, and bladders to a certain extent as well. But there's a little bit of a crossover with gynecology there. But we do all the male reproductive side of things as well. So yeah, it's more than just the genitals.
Glad to hear.
Yeah, but and I'm mainly, we all sort of subspecialize within that specialty, and I mainly deal with kidneys and prostates. So prostates obviously being a male gland and major cause of problems as you get older. So yeah, we're pretty busy.
All right. No, I'm just really interested, and I think we'll get to the podcast later, but obviously, even talking about this stuff is stigmatized, and I think men in general, obviously, and things are changing a bit, but men in general rather shy away and not talk about, their issues when it comes to this sort of stuff. So yeah, I think the fact that you've got a podcast on this stuff is really, really, really interesting, and you're actually doing what most men struggle to do, which is sitting down and talking about this stuff. And obviously you're an expert, but yeah, I think that's really interesting, and hopefully it could encourage more conversations for anyone really that listens.
Well, the podcast sort of started out that our practice wanted to have something that our patients could refer to. So we thought we'd record a whole lot of episodes with information about the conditions that we treat, and it's not going to replace a consultation, but it's quite good when you see patients and you talk about things and they may forget what you've said. So you can provide them with written information, but it's quite good for them to go and listen to a podcast, because it's a more sort of conversational, informal way of getting the same amount of information across.
Yeah.
But then we, so it started out like that within our practice, but then a couple of the other dads from school, Addie and Lloyd, we got talking about things, and it turned out that Addie, who's not a medical doctor, but he's a marine scientist, he's done a few podcasts related to his business, and he was very keen to get involved and help me out with the podcast. And and Lloyd, who's also a doctor, he's a GP, but he's got a very big interest in men's health, so that's most of his practice.
Yeah.
He was very interested in doing something as well, so he was about to start his own podcast, and we said, look, why don't you join us, and we'll make it broader to broaden the appeal and make it men's health.
Yep.
So while I am a urologist, and I can, a lot of the initial episodes to get the ball rolling have been on urology, and I'm definitely an expert there. I wouldn't say I'm an expert in men's health. So I've learned a lot actually from doing these podcasts as well.
Yep.
And I guess the main premise of it was that we wanted to, just open up conversations around men's health so that it, increased awareness of issues and made it easier for guys to talk about things. And there are a lot of probably similar podcasts out there that do a similar sort of thing, but they're not always, backed by medical knowledge. So, there's a lot of ones which are slightly accurate, but slightly inaccurate as well. So we thought that we were in a good place in order to provide the expertise from that point of view. And we know a lot of people, a lot of colleagues that are involved in issues around men's health as well. So we thought we'd have access to a lot of guests, which has been good as well.
And was it you that came up with the name Tackle Talk?
No, we sort of discussed the whole name of the podcast actually on the latest episode that came out. I think we initially wanted to call it Ask a Urologist, but the other guys thought that was a really boring name.
Tackle Talk's a bit more marketable.
Tackle Talk's a bit more marketable, but there's actually a bass fishing podcast in the States called Tackle Talk.
Right.
And I was a bit uncomfortable about having the same name as that. But then we
very different things.
Our podcast editor said, no, that's perfect because people will stumble over your podcast by going to Tackle Talk. And, that's exactly our sort of demographic of
men,
of men, like middle-aged men going out fishing.
Sitting around talking about, their health issues whilst they're fishing, right? Yeah,
They come to learn about fish, but they actually learn about things like Perion's disease?
Peyronie's disease.
Yeah.
That was
very graphic episode I listened to the other day, but
yeah,
it was interesting. It was very informative.
Yeah. It's one of those things. Again, it's an embarrassing problem if men have it. So, they're not going to go around talking at the pub about it necessarily. But, if they did, they'd probably find out there's quite a lot of men that have that problem. So we've got an expert in our practice, a couple of guys who are experts in it. So we thought, that's easy. We just get them on the podcast to talk about it. So a lot of the initial topics have been urology focused, but we're sort of broadening out now.
Well, sorry, I jumped ahead. I know you probably wanted to ask more about becoming a urologist and how long it took you to study and train. Was that
Um,
How many years?
Because obviously it's a very specialised field, and you're a doctor, and that obviously that's a long road to get there.
Well, I originally went to medical school in New Zealand. Well, that's where I am from, and that was 6 years then. I think it's fairly similar now.
Yep.
Depending on which pathway you go, and then you sort of spend about a couple of years, or it's a variable length of time, kind of doing various junior doctor jobs in the hospital and trying to figure out exactly what you're interested in. And most people, broadly speaking, would go into either medicine or surgery. So, medicine being more the diagnostic, trying to figure out what's wrong with people, prescribing them medication, whereas surgery is like a procedural specialty where you've been given the diagnosis and they have to have an operation, and different surgical specialties are things like urology, orthopedics, plastic surgery, neurosurgery or brain surgery, ear, nose and throat surgery. And all of that used to come under a general umbrella of general surgery. Back, probably about 50 years ago, a general surgeon would be able to do all of those things. But over time, it's gradually specialised into the different categories of surgery because, the number of procedures and the detailed information that goes along with each is so vast and exploded. So Urology certainly was one of the first to break away from general surgery. So it used to be part of general surgery. And certainly a lot of people who train in urology have done a bit of training in general surgery as well. It's quite useful to know those skills. So general surgery is generally like abdominal surgery. So, you typically, they'd take your appendix out or, if you have bowel cancer or things like that. So it's kind of like, or take your gallbladder out, that type of thing. So that's kind of been left to general surgery. Now, urology, when I went through it, it was already a different training program. So you spend a bit of time, you go and talk to someone who's a urologist and figure out what you have to do to get on the training program. And I mean, a lot of people ask me, why did you become a urologist? That sounds really weird.
Yeah, fair enough.
But they're kind of,
it's an important
confusing what you do with some sort of like, almost like you have to, if you deal with a certain part of the body, it means that you're got a fetish for it. It's like that doesn't make sense.
We'd be screwed if we had 1 million neurosurgeons and no one else.
I mean,
the whole world would hurt.
Nobody says that like about any other job. Like, do they say about accountants that you get aroused when you see a spreadsheet or something like that? I mean, maybe you do.
No,
I don't know.
No.
But
Some people
definitely not. I wanted to ask about operating and being in the emergency room.
Yeah.
Because some procedures can take a long time.
Yeah, they
So
can do.
what's the longest you've been in an emergency or an operation?
Before I did urology, I did about 6 months of cardiothoracic surgery.
Yeah.
And which is hearts and lungs and stuff. And I was scrubbed in for an operation that took 14 hours.
Jeez.
And I didn't go to the toilet during that time. So
if you really have to go, how can you?
Bad for urology.
Bad for urology.
Yeah.
That's when you learned.
I just kept thinking, should I
Gonna get a kidney stone?
just because you're quite junior at that stage and you're sort of like a little bit scared of,
Trying to impress.
Yeah, and you don't want to be.
How do you eat? Do you get like gummies or anything to keep the?
You can get like the nurse to shove gummies into your mouth through the mask.
And that's it for 14 hours?
Yeah, and they can stick a straw through there for you to drink stuff.
And if you actually have to go to the bathroom?
I mean, that's an extreme case. I mean, if you were smart, you'd have a break and go and freshen up and stuff. And so, I mean, it's not a good idea to operate for a huge long period. You just get tired and you can. It gets more and more stressful. But I guess in some cases, and this was a really, really difficult case, it was kind of life and death, and you had to be there to help out. So yeah, that was a pretty tricky one. But no, I mean, one of the things, I mean, you asked me why I did urology.
Yeah,
well, a lot of our procedures are quite short, so that's good, and. For the really long procedures, I've kind of over time excluded myself from those. So I can't really stand anything that goes longer than 4 hours. That includes
it's still a long time.
It's a long time. Yeah. Well, most of my operations don't go more than 2 hours. So I think that's about enough. And you asked about how I got into urology. And look, it's like a lot of things. That you guys will probably find, as you go through your careers, is that a lot of the time you're sort of influenced by people that you work with, and I had some really good mentors who I looked up to, and a lot of surgical specialties they attract different types of personalities depending on what the specialty is, and I guess I looked at the people who were doing urology. This was back in New Zealand, and I thought, they've got a pretty nice...
Good vibe.
Yeah, they've got a nice attitude to work and lifestyle, and they're kind of like what I'd like to be, like in 10, 20 years. Plus, I had a couple of mates who were doing it.
Yeah.
And I bumped into them. They'd been a couple of years ahead of me at medical school, and they said, come and do urology. It's really good. It's like, it's such good operating. It's not... the operations are quick and there's lots of work, and the training scheme's really cool, and all the guys that are doing it are really cool. And they said, "Oh, we'll help you get on." So back in those days, it was a bit of it was almost like you had to mount a campaign to get noticed, and it was a process. And it probably takes about 2 years. Like, you'd have to get to know the people who made the decisions, and make sure that your name was on their radar, and then get a job to work for one of them and try and impress them. And then you'd have to get a research project and get that all done and present that at a national meeting with all the urologists there. That's quite intimidating, because they're sort of like saying, "Who are you?" And you're trying to, show that you know something about a topic where they're experts and you're actually a complete novice. So,
how many years does it take? Does that specialization take? Because obviously you've got your 6 years medical school.
So look, I mean, all in all, to go from the start of medical school to when I sat my last exam was about 12 years.
Yeah, right.
So 6 years of medical school, then a couple of years of just being a dog's body, and then about 3 or 4 years of training. I think the training is actually longer now.
Yeah.
And then even after you've finished your final exam, you have to go overseas or go somewhere else and get a bit more experience in a more subspecialized area.
Yep.
So it was about I got my first consultant job in Perth in 2004. And I was 33 at that stage, so
yeah,
a long time.
I was just going to go back, and I know it was an off air kind of. I don't know if it would have been, but the stuff you were saying about not becoming desensitized, but almost seeing so many cadavers and that sort of experience, and having that pretty early on, and working out whether you're cut out for it.
I think it goes to what we were talking about, where people sort of say, "Oh, you're dealing with that part of the body, isn't that a bit gross?" But one of the things you're taught to start with at medical school is to get desensitized to the body.
Yeah.
Not in a way where you don't care about it, but you look beyond what the actual part of the body is, and you look more at the function and the structure and the things that can go wrong, and it becomes more like a problem-solving exercise. So you do have to be aware that patients are embarrassed and sensitive about certain parts of their body. That goes along with it, but we don't sort of get squeamish. I mean, there are times when I get grossed out, but it has to be really bad.
It pretty serious.
Probably too graphic to say.
I could tell some stories, but I'm not. I won't. No, I mean, there's you can see all those programs on the late night reality TV channels.
It becomes. I can't believe there's the embarrassing bodies, whatever it is.
But you have to sort of like just remind yourself there's a person underneath that. It's all superficial appearance on the outside. There's if we were all blind, it wouldn't
matter.
It wouldn't matter. It's just that you're making a judgment based on one sensation, which is your vision. Of someone. So
it's all about the personality.
Interesting.
Well, you have to take that into account. Definitely. You have to just treat the person on the inside.
I hear that one a lot.
It's all about the personality.
Just kidding. But we did actually prepare some just questions, some general knowledge questions that people
Mythbusters,
so a bit of a tie on Mythbusters, but ballbusters.
Yeah,
ballbusters.
So some interesting questions you might.
Because obviously there's a lot of myths out there, and we thought we'd get them all out, and especially for our predominantly male listener
18
base,
to 24-year-old demographic.
I mean, I think when it comes to awareness as well, especially for young people, they're going to think they're invincible, right? Especially coming out of school, starting uni.
But you're not.
And obviously, you're not. So just make sure. No, here's the myth that we want to. I guess we want to.
Is it okay for one testicle to sit higher than the other? I'm definitely asking for a friend on this one.
It's quite normal. Usually where the testicles sit in someone who's a fully grown male depends a little bit on the tightness of the muscles around it. And So yeah, it's normal for one to sit slightly higher than the other. If they sit really high, like up in the groin, and they can't be milked down or pressed down, then that's an abnormality called an undescended testicle. So that's usually associated with the fact that it's an abnormal development, and they can be all the way up into the back of the abdomen as well. So usually they're smaller, they haven't developed normally, and those ones can actually be at increased risk of cancer as well. So sometimes we remove those ones. But once if they're dropped in your ball sack or your scrotum, and it's normal for one to be
sweet.
higher than the other.
There you go. Yeah.
It's a relief. Did you want to go next?
This is on a more serious note, but obviously there's a lot of stuff out there about how testicular cancer is quite common in young men. Out of probably all the cancers, is it possibly the most common?
Yeah, it's the most common solid organ cancer. So I think leukemia might be slightly higher in incidence.
Yep.
Yeah.
Yeah, no,
which is a blood cancer, so doesn't count as a solid organ cancer. Yeah.
Do you see lots of young patients that do have testicular cancer, and what is what is the most common age range, I guess, that you get? In your practice that are.
Yeah, so the most common is sort of between the ages of 20 and 40, I suppose.
Yeah,
so
right.
That's the most common cancer at that age. It's but it can occur in the teens as well.
Yeah.
And we've got a podcast episode coming out on testicular cancer, and I think there are campaigns to raise awareness on it, just for self-examination and making sure that boys don't feel embarrassed about it or try and ignore it because they don't want to tell their mum or their friends or anything like that. It's amazing how often it's found by a guy's partner. And they're going, this doesn't feel right. This wasn't like this a few months ago. And they're the ones that are sort of forcing the guy to go and get checked out. It's very easy to get checked out with an ultrasound, and that's a very sensitive way of picking it up. And it's one of those cancers where it can grow really fast. So the faster you diagnose it, the better the outcome.
That's good. That's
next question. So growing up, my dad would always tell me that when you're sleeping, not to wear too many layers of pants around your gonads because the heat may cause issues with fertility when you're older. Is that a myth or real?
Well, it is true that the testicles like to be at a cooler temperature for sperm production, or spermatogenesis as we call it. So for couples that are trying to conceive, they're often told to not have the guy's not told not to have a hot bath, before he.
Yeah, right.
Before they,
I didn't know that.
have a go. So, that's why the testicles are outside the body. Outside the abdomen is that it's a couple of degrees cooler down there.
Oh, interesting.
Unless you're wearing multiple layers of underpants.
Very interesting. These are things that you just never know.
And they just shrivel up.
Well, that's the muscles
shrinkage.
Sort of contracting. Yeah.
We should ask about that's going to be my next question is shrinkage. Should people be ashamed of shrinkage, or you just got to own your shrinkage?
No, it's all. I mean, the vascular. It's especially the penis is basically a blood sponge. So vascular spaces dilate in warm weather and contract in cold weather.
A laptop on your belly when you're sitting there without anything between your laptop and your skin, is that the Wi-Fi radiation, or that bad for fertility?
Are you saying you're using it while you're naked?
No, but say you don't have a say you don't have a shirt on and you're just lying in bed watching YouTube and your laptop's sitting on your stomach. Is that bad for it to be so close to your gonads?
Or just in general radiation with your phone in pocket and stuff?
Yeah, I'm not aware of any problems with it. I think the level of radiation is probably so low that it's not going to affect things too much.
There you go. Because there's Campbell a couple of times.
I've heard about it before. So I've seen Gianni and I've told him to put the pillow under the laptop.
Oh, okay. Yeah.
You've concerned me. But that's interesting.
I'm not actually aware of the amount of radiation that comes out of a phone or a Wi-Fi signal.
Yeah.
So that would be interesting, but I don't think it's too bad. I mean, I remember when we were students, and we were sharing a house with some girls, and it was myself and a mate. We'd sort of moved in, and that they already had the flat. So when we were sort of inspecting it, one of the first things we made them change was the microwave was at waist level in the pantry. We said we got to move that.
It's a very doctor thing to
yeah, we said this is a nightmare. This is a nightmare. This is like impacting our fertility. But having said that, look, as part of my job, we use X-rays a lot, and we do wear lead gowns. But I'm probably exposed to low-level radiation on a daily basis, which is way greater than that comes out of the laptop or the phone. And I've got 3 kids. They are a little bit weird, but that might account for it.
This is another probably a big one, a big myth or ball breaker. Ball buster. The old breaking the seal thing, is that a myth or is that a real thing, that if you're drinking and you go have your first piss, then you're going to just keep going back? I'm really intrigued about that, because everyone always asks about if breaking the seal is a really big thing and say, don't break the seal. But for me, it's just like, well, obviously you're drinking a lot, it takes time.
I think that's right. Yeah. It does seem to be a real thing though. Like people definitely anecdotally report that's the case. But I think you're right. It's just the fact that you've been drinking so much.
Yeah.
Alcohol is a diuretic, and it creates more urine, and it causes irritation to the bladder as well. So all of those things probably are accumulating, and then once you've gone for the first one, then you've got a whole, usually if you're hanging on, you'll build up urine, but you're probably not producing as much urine, so it backs up a little bit. It doesn't really back up to the kidneys, but if you empty your bladder, you will get a whole flood of extra fluid being passed through your kidneys back into the bladder, so it'll fill up again quite quickly if you've been drinking a lot.
Well,
there you go.
My last question is a bit more technical. The refractory period, can that be affected mentally, or that's just purely physical?
So you're talking about with
after you've done that, how long before you can then do that again? Is that because I've read that for younger males it's more 30 minutes, whereas as you get older, for 7-year-olds it can be up to 20 hours. But I've always thought, is there...
Sorry, what? 70-year-olds? Did you say?
Yeah.
70-year-olds, yeah. Look, I think it is one of those things that's related to age. Yeah, definitely.
There's no mental aspect involved?
Look, there probably is a little bit of a neurological aspect to it. So if you want me to get really technical,
go ahead.
The act of getting an erection is part of the parasympathetic nervous system, and I think after ejaculation, there's probably a period where those nerves just don't fire again for a while, and whether that's some evolutionary thing to allow you to just get your breath back or whatever, or it's probably got a physiological basis, more so than a mental basis, I'd say. Yeah.
Interesting.
It's good. I haven't really looked that one up, so I'd be happy to be corrected if anyone...
Could be a tackle talk episode.
Any experts out there on the refectory, whatever it's called, refectionary? I was going to ask you about the opposite to almost my last question, is holding it in and the issues you can have from, like, urinary tract infections and kidney stones and whatnot. Is that an actual thing, or am I just talking
for
rubbish?
Holding your urine
in?
No, look, it's known that not emptying your bladder properly puts you at higher risk of urinary tract infections.
Yeah.
And bladder stones, not so much kidney stones, but bladder stones, because and that's one of the things we deal with guys who have chronic retention of urine, is that they'll get precipitation out or of the past the urine, usually uric acid, which starts to form crystals and then it clumps together and forms stones, and so that's how bladder stones occur. So they're different from kidney stones.
Yep.
So definitely it can be a problem. So the bladder has to empty completely each time you pee.
Right.
Otherwise you can run into trouble.
So break the seal.
Break the seal.
Break the seal
You've
is,
heard
is what
ball
I've got out of
busted,
that.
you've
Yeah,
heard it,
ball
you've
busted.
Don't
break
hang
the
on
seal.
too long. Yeah, you can overstretch your bladder, and then you get it. It makes it hard for it to recover sometimes.
Well, just in general, is there any sort of misconceptions that people should be aware of when it comes to sexual health, or things they could be doing that would vastly improve it, or things they're doing that are vastly affecting it?
Look, I'm not a sexual health expert. I could put you in touch with someone who'd be very good to have on your podcast, actually. But look, I think the main thing with young guys is probably to practice safe sex and decrease the risk of sexually transmitted infections, because they can have like lifelong consequences if you have ongoing problems, and one of the long-term consequences of recurrent urethritis is you can get urethral strictures, and we sometimes see that in men. It's getting more common again. It didn't used to be such an issue, but I think those sort of infections are on the rise.
I want to ask about what is one of my biggest nightmares.
Oh no.
And lots of men's probably biggest nightmare, if they even think about it, I don't know. Testicular torsion.
Yeah.
I've had a couple mates that have told just horror stories about, they fall on something, or I don't know, even just they do something really innocuous, and then they're just just filled with immense pain.
It's pretty
and obviously
painful.
You probably have to deal.
Yeah,
deal
it's a
with
bit
that.
of it's one of the urological emergencies that we deal with. So there's not that many. Kidney stones would be another one, and so it can happen very suddenly. It usually happens in sort of adolescent males, but it can happen in young men as well. I've seen it happen in someone as old as 40. So as you sort of go through puberty and the balls get heavier, if the lining around them is quite loose, which is just a developmental thing, then they can twist on their blood supply. So if that happens, then the blood supply gets cut off, causes a lot of pain and swelling, vomiting, usually feeling very sweaty. Quite severe pain, and you've got about 4 to 6 hours to untwist it. Otherwise, the testicle can die.
Far out.
Yeah.
So it's a blood flow thing. That's
It's a
interesting.
blood
I
flow
didn't know
thing.
that.
Yeah.
You'd find a lot of people, especially our age, if that were to happen to them, they might just try and not tell anyone, might be a bit scared to tell anyone.
I just
and
got
then,
hit in the nuts. Like I'm just,
or
Yeah.
if it's over, like while you're sleeping.
But I feel like you'd know.
Yeah. You usually feel very severe pain, and I guess the take-home message would be if you get that severe pain, you just got to put your hand up and go to the doctor straight away, or go to emergency. Yeah, and they know what to do. They'll sort it out straight away.
Well, I wanted to swing back a little bit towards Tackle Talk.
Yeah.
And sort of the goals for Tackle Talk when it comes to not just talking about urology and men's mental health, but overall how you're planning on packaging it to your audience and continuing to give out content.
Yeah, at the moment we're still got our training wheels on, I think. So
Same.
yeah. Oh, you guys are a lot more sophisticated than we are, I think. So I've learned something by coming here. Yeah, we're just having a go at the process, and we enjoy doing it. So it's a new thing for all of us, and it seems to be pretty well received by the people who've heard it so far. And I think the next thing would be to try and push it to a wider audience, and probably do a bit more marketing around it, and develop it into a good conversation space, I suppose, for people to ask questions as well. So we'd like to allow people to throw questions to us, and we'll have another Q&A sort of session. We're hoping to do like a recap on things every 10 episodes or so. So we sort of go over like the previous 10 episodes and figure out what we've learned and what the things that we might have not mentioned, and just review things, and just continue having really good guests on. So yeah, we've got some quite exciting content coming up in the future, and it seems to be very well received. There seems to be a lot of
There's a market for it, for sure.
I think there's a lot of people that want to hear that sort of thing.
Yeah, a lot of unknowns,
and
especially people our age.
Yeah, that's right. Yeah, so we're covering everything. We don't really cover kids stuff, but we're covering everything from adolescence to old age.
Yeah.
And there's a lot of issues, especially around younger guys whose health is probably taken for granted sometimes. But if you look at it, it's probably for younger guys sort of up to the age of 25, it's probably more around mental health issues because your body changes so significantly in those sort of teenage years, but your brain does as well. Yeah. And then you sort of come out of school and you've got all these sort of societal things to take on board, and going to university or getting a job, all that sort of stuff, all those sort of pressures of being an adult. So those things are not really talked about. And one of the big health issues I think for young guys, apart from what we've talked about with testicular cancer and sexual health and all that sort of stuff, is probably like their risk-taking behavior, because you do feel invincible. And I feel like a bit of a hypocrite saying this, because I'm one of those middle-aged guys who probably thinks I'm still 25, and that's probably why I fell off my bike. But accidents, one of the biggest causes of health issues in young guys, whether they're related to risk-taking behavior with or without the influence of alcohol and drugs, because people just don't think that the bad thing is going to happen to them.
I was going to add, how have you, obviously you've probably been through some pretty stressful moments throughout your time, and some pretty stressful procedures and life or death situations. Is there anything that you do in particular to step away? You mentioned walking your dog, and do you have any practices that you're
I think mainly the exercise is the thing that I do. I find that's the best. I think that's one of the best antidepressants out there. It's just getting your heart rate up and getting the endorphins pumping, that type of thing, and just having that moment away from everything. We're lucky we live in a lovely part of the world, and we can get outside a lot, and a lot of sunshine hours. So just trying to take advantage of that as much as possible. And I think everybody, needs a hobby, and you need sort of things to do and new sort of challenges for your brain and all that sort of stuff. So I played a lot of guitar when I was in my teenage years, and then I went for years without doing it. So I've started picking it up again. Yeah. And trying to do that, and I'm still terrible at it, but I'm slowly getting better, just a little bit by a little bit. Is the muscle memory there, sort of? Yeah. You sort of you bring it back, and you try and get calluses on your fingers and stuff, to make it not hurt so much. But that's been a nice little journey to try and learn something and just get better at something. It's one of those things that it's really important to do, and whether that's painting or
anything,
woodwork or anything, there's all sorts of things you can do. So
Fortnite,
yeah.
Is that a no? Or it's an escape. It's got building in it.
If you're playing with your mates online, it's a little bit of a social aspect. If you're playing by
fake
yourself,
dopamine,
then I think it's a bit of a problem.
I used to be really into video games when they were terrible. The pixels were this size.
Right. Okay.
Doom and Duke Nukem and all that sort of stuff. Yeah.
Interesting.
But I worry I'd just be wasting so much time. My sons are into it. They love it, but they play online with their friends, and you sort of like threaten to take it away, and they say, "Oh, that's how I socialize these days."
Oh no,
that's a bit sad. I said, "Well, look, if it becomes a professional Fortnite player, that would be good. I'd be happy with that."
Bit of money involved.
Yeah.
Awesome.
Yeah, there is a lot of money involved in that.
Well, Tackle Talk, where can we find you? Where can the audience listen to your stuff?
So we're Tackle Talk Men's Health, not the fishing podcast. But
you should do a partnership with them.
We should, we'll get there. So there's them, and there's a NFL podcast, which I think has stopped recording. So we're on Apple Podcasts and Spotify, and we're tackletalkmenshealth.com.au if you want to go to our website. We're on the Podbean podcast network. So yeah, it should be pretty easy to find it. But if you'd have to put Tackle Talk Men's Health,
We'll put all the links below in the description for you guys.
Yeah,
So
yeah.
Thanks very much for your time.
Hey, thanks very much. It's been a lot of fun. We'll have to have you guys to come and on the podcast.
We'd have to study up something. What would our area of expertise be?
Young dumb males.
We'll find it. We'll find it.
Yeah.
You'll have to bring all your we'll have to bring some extra microphones in though, I think.
Yeah,
We'll figure it out.
We'll
figure it out.
I'm not sure what the optimal number of people
on
a podcast
before they
is.
just
We can
start
probably
talking
find
over
it.
each
Yeah,
other,
yeah.
that could be a good question. I wonder what that is.
I've heard up to 5 sometimes. I think it's
Yeah.
okay if you're all in the same room, but when you're all like on Zoom or something, it's everyone starts talking.
We don't do Zoom or Bluetooth or any of those. It's a bit too technical.
We
for
should
us.
start calling people in maybe, but
We've done a few. We've called people, yeah. So that it does work quite well. It's always quite good quality.
Yeah.
So it's a good way of doing it.
With Zoom or
We haven't done it with Zoom. We've just done it. I just
FaceTime, Bluetooth.
Yeah, you can hook up your phone
I've
to
seen
the
that,
to the roadcaster. Yeah.
Awesome. Well, thanks very much for your time.
Yeah. Thanks.
Dr. Tan, thank you.
Thanks, boys.
Thank you very much.